Welcome to the second Ryan White Planning Council public hearing for 2025. The public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view and download the documents from our website at rwpchouston.org. I am Skeet Boyle, co-chair of the Affected Community Committee of the Ryan White Planning Council. Also with us this evening is the 2025 Chair of the Ryan White Planning Council, Josh Micah, Peter Gray Ledbetter, and Jay Baumick, Baumick, co-chairs of the Priorities and Allocations Committee, and Rodriga Avila, Community Engagement Coordinator of the Ryan White Planning Council's Office of Support. Focus of tonight's public hearing is to recommend funding allocations for fiscal year 2026, which will begin on March 1st, 2026. But first, there will be a presentation on Project LEAP by Rod Avila, who is one of the facilitators of the program. Afterwards, Jay will give an overview of the Priorities and Allocations Committee process, followed by Peter, who will present the fiscal year 2026 funding allocation recommendations for services funded by Ryan White, Part A, Minority AIDS Initiative, referred to as MAI, Ryan White, Part B, and State Services Grants. The allocation recommendations include level, increase, and decrease funding scenarios for each grant. Remember that everything discussed here will not affect how services are delivered now, but will impact how services will be delivered approximately 10 months from now in the year 2026. After the presentations, I will explain how you can give public comment regarding the information presented. At this time, I would like to turn the meeting over to the Chair of the Planning Council, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you, Skeet, for that informative introduction. Good evening, everyone. I am Josh Micah. I use he, him, and L pronouns, Chair of the Houston Ryan White Planning Council. I am pleased to welcome you to our public hearing. I will briefly describe the history of the Planning Council and what is that we do and why are we here tonight. The Ryan White program is the largest federal program focused exclusively on providing HIV care for people who don't have significant health coverage or financial resources to meet the challenges of living with HIV. Ryan White fills in the gaps in care that are not covered by other resources. The Ryan White HIV/AIDS Treatment Extension Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and in 2009, adjusting with each reauthorization to accommodate new and emerging needs, such as increasing emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with governmental entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one is designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to improve metropolitan areas and are awarded to the chief elected officer, primarily responsible for the providing health in the geographic area. In Houston eligible metropolitan area, that person is County Judge Lina Hidalgo. In 2024, Harris County received over $27 million to provide services for people living with HIV in the 6-area county, which includes Harris, Fort Bend, Liberty, Chambers, Waller, and Montgomery counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part B and state service funds. Part B funds are awarded directly to the state of Texas and are used to provide care for people living with HIV in a 10-county area, which includes the 6 counties named previously, plus Austin, Colorado, Walker, and Wharton counties. In the fiscal year 2024, Ryan White Part A, Part B, and state services dollars totaled over $32 million. Again, Congress requires that most of these funds to be used for medical services for people living with HIV in the 10-county area. Currently, half of the 31,000 people living with HIV in our area are using Ryan White funded services. By law, the council is responsible for determining the number of individuals in our area who are living with HIV, assessing the needs of the community, establishing a comprehensive service plan, setting service priority and allocation funds, assuring that there is sufficient services to meet the future needs of the changing epidemic, assuring that appropriate services are available to meet the needs of the underserved and underserved women, infants, children, and youth, ensuring access to services for those who have substance abuse treatments, and assessing the administrative mechanism which produces services and distributes funds. The Planning Council falls under the Texas Opens Meeting Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in hybrid format, which gives you the option of attending in person or virtually. The council meets on the second Thursday of every month at noon. For more information, call the Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information will be repeated to you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. This means that all other resources for individuals must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid, or Medicare benefits before they're eligible to have Ryan White monies pay for primary medical care. There's also income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means that an individual with a yearly income of 46,950 or less would be eligible for assistance provided that all other avenues of coverage have been exhausted. The same guidelines apply for a single parent with one child would be 63,450 or less. The service category allocation will be reviewed this evening. Includes services funded by Ryan White Part A, Minority AIDS Initiative, referred to MAI, Part B, and the Texas Department of State Health Services. Example of these services which Ryan White program funds are allowed to provide include outpatient primary medical care, medications, or healthcare, mental health services, and assistance to pay for health insurance premiums, copays, and deductibles. The purpose of this public hearing is to inform the community about the recommended services funding allocation for fiscal year 2026 in order to get feedback from consumers of Ryan White funded services and others as how the recommended changes will affect their ability to receive medical care and supportive services. Community input is not only necessary, it is vital for all planning council processes and is encouraged at every level. At this time, I would like to introduce.
Thank you, Josh. Hello, everyone. I want to talk with you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The program is called Project LEAP, which stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start at the end of July, and the program is free. But the expectation is that the students that participate in one class a week for 17 weeks, and they come to class prepared to listen and engage with the presenters and with one another. Project LEAP is unique to Houston and is only offered to 30 students a year. The goal of the program is to provide skills so that graduates use these skills to become active and effective participants in the local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group. Graduates help to shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, social workers, consumers, and others to design services. If you are a person living with HIV and you have a friend or family member that is challenged by HIV, you are a perfect candidate for the class. How does Project LEAP work? Classes are held on Wednesdays for 17 weeks with approximately 30 students in the class. Each class is about 4 hours and includes hands-on activities, group projects, and field trips. Lunch is also provided. Guest speakers are experts in their field and enjoy sharing new and updated information with students. What will you learn? As you can see from the long list on the screen, some of the topics covered in the class include HIV 101, the history of HIV in the Houston area, tools for designing and funding services, leadership training, and much more. Class participants learn valuable skills, including meeting facilitation and Robert's Rules of Order. Don't worry if you don't know what that is. We will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings with role playing. We bring in expert speakers. There are hands-on activities, class projects, and again, field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or are affected by HIV personally or professionally, and who can meet the class expectations in terms of attendance and participation. What do you get out of Project LEAP? You get knowledge and skills that help you advocate for your health as well as the health of others. You get an extensive binder of information with easy to read materials about HIV. You get access to experts, mentors, and as well as new friends who share your passion and concerns for the issue. Most important of all, you get the opportunity to make a difference for people living with HIV. So how do you apply to be a Project LEAP student? You must submit a written application before July 19th. We will call you and set up an interview, which can be in person or virtual depending upon your comfort level. The classes will be hybrid, so students can choose if they wish to participate in person or virtually. Classes will begin in early August and end in late November. To find out more information or to apply, go to our website, which is rwpchouston.org, or call at 832-927-7926, or send me an email at rodriga.avila@harriscountytx.gov, and I will get back to you. This contact information will be repeated at the end of the public hearing. We would love to hear from you.
Thank you for the valuable information, Rod. Many current and former council members are graduates of Project LEAP and would agree that the training is very valuable for those who want to be involved in the planning process. Speaking of the planning process for HIV services, each year in April and May, the Quality Improvement Committee of the Ryan White Planning Council considers many facts when reviewing the definition of each Ryan White funded service category. When the quality improvement committee changes what is offered through a service, the changes are based upon information such as the documented needs of various populations living with HIV in the greater Houston area, the history of service usage, epidemiological trends, and the availability of alternative resources, including both Ryan White and non-Ryan White funding. Once the service category definitions have been approved, it is time for the Priority and Allocations Committee to prioritize the individual service categories and allocate monies to each one. Tonight, we are going to talk about the work of the Priority and Allocations Committee. The mechanism for awarding Ryan White funds changed in 2014, and we are now seeing southern parts of the country, such as the Houston eligible metropolitan area, receiving higher grant awards, while areas like San Francisco and New York are experiencing significant decreases in their award amounts. That is because the South is where the new diagnoses are on the increase. Starting in 2015, the Houston area received an increase every year except two, where we got a small decrease. This is good news for the Houston area, but some would say that we have been underfunded for many years, and we now have the opportunity to catch up with the growing number of people who need our services. In addition to a Ryan White grant, Houston also receives the Minority AIDS Initiative, or the MAI funds. The goal of the Minority AIDS Initiative is to address racial and ethnic disparities in HIV-related health outcomes and expand the community-based capacity to serve people of color living with HIV. In recent years, a significant factor in determining the allocation of funds to individual service categories has been the availability of private health insurance offered through the Affordable Care Act. There are currently about 6,100 clients registered in the Ryan White system that are enrolled in either public or private health insurance. The anticipated results is that there will be a reduction in the use of Ryan White funded medical services and an increase in the number of clients needing help through the Ryan White Health Insurance Assistance Program. Another significant factor is unpredictable application processing time and changes in eligibility requirements of the Texas HIV medication program, commonly referred to as the ADAP. As you know, access to medications is vitally important, and we are allowed to use local funds to fill this gap. This year, the recommendations from a special work group were also considered during the allocation process. The work group emphasized the critical need for Spanish translation services and medical interpreters. Given the linguistic diversity of the Houston and Harris County area, it is essential that all individuals living with HIV receive care that is both linguistically appropriate and culturally competent. In addition, the Quality of Life work group identified the unique needs of individuals over the age of 50 who are aging with HIV. Both the condition itself and associated treatments can lead to premature aging, thereby increasing the need of services typically categorized as geriatric within the general population. The proposed service priority rankings and funding allocations to be presented tonight are for the fiscal year 2026, which begins on March 1, 2026, and includes the following funding streams: Ryan White Part A, the MAI, Part B, and state services. The proposed service priority rankings for 2026 are based primarily on use and need as documented in the 2020 Houston HIV Care Service Needs Assessment. The fiscal year 2026 allocations are informed by fiscal year 2024 expenditures, final allocations for fiscal year 2025, and the anticipated number of clients utilizing Ryan White funded services, including those who enroll in private insurance but require assistance with premiums, copays, and deductibles. Currently, approximately 15,000 people living with HIV in the Houston area rely on Ryan White funds for some or all of their HIV-related medical care. While the 2020 needs assessment provided the foundational data, preliminary data for the upcoming 2025 needs assessment based on the 2023 and 2024 information has also been incorporated. The full 2025 report will be released in early fall 2025. We invite you to attend the Comprehensive HIV Planning Committee meeting on July 10th to review and provide public comments on the service-specific fact sheets and final edits to the 2025 needs assessment. I will now present the service priorities and first of the three different funding scenarios, the level funding scenario, which assumes we will receive the same amount of funding in 2026 as we did last year, did we this year. Detailed information about all of the funding scenarios is included in the information packet, which is available by email. The first 9 service categories are defined by the federal government as core medical services, and the legislation requires that we spend at least 75% of our grant funds on the direct medical care for Ryan White clients. The remaining 25% can be spent on support services, such as transportation to medical appointments, service linkage, and more. The Houston area typically spends 80% of our Ryan White funds on core medical services for the Ryan White clients. The recommended allocations for the 2026 are the same as the fiscal year 2025 final allocations unless otherwise noted. Priority number 1, ambulatory outpatient medical care. The proposed allocation for Part A is $11,440,679 plus $2,098,411 in the Minority AIDS Initiative funds for a total allocation of $13,539,090. Priority number 2, local pharmacy assistance programs. The proposed allocation for Part A is $2,067,104, including core services. Priority number 3, oral health. The proposed allocation for Part A is $166,404, and the proposed allocation for Part B is $2,732,193 for a total allocation of $2,898,597. Priority number 4, medical case management. The proposed allocation for Part A is $1,790,093 plus $318,597 in Minority AIDS Initiative funds for a total allocation of $2,108,690. This allocation was reduced by 18% overall based on the expenditures and the administrative overhead to perform quality management projects. Priority number 5, the health insurance premium and the cost sharing assistance program. The proposed allocation for Part A is $1,442,528. For Part B, it is $805,845, and for state services, it is $1,189,769 for a total allocation of $3,438,142. The priority number 6, the medical case management. The proposed allocation for Part A is $1,790,000 and $93 for a total allocation of $3,438,142. The priority number 7, the Mental health services, the proposed allocation for state services is $300,000. Priority number 7, medical nutritional therapy. The proposed allocation for Part A is $341,395. Priority number 8, substance abuse treatment. The proposed allocation for Part A is $25,000. The priority number 9, hospice services. The proposed allocation for state services is $259,832.
The remaining service categories are defined by the federal government as non-core or supportive services. Priority number 10, non-medical case management. The proposed allocation for Part A is $1,204,875, and the proposed allocation for state services is $150,000 for a total allocation of $1,354,875. The state services amount was reduced by $75,000 to help fund health insurance assistance. Priority number 11, medical transportation. The proposed allocation for Part A is $374,911. This includes bus passes, van service, and gas vouchers for those living in rural areas. Priority number 12, emergency financial assistance. The proposed Part A allocation for the pharmacy assistance subcategory is $2,039,136. I'm sorry, y'all. And the proposed Part A allocation for the other subcategory, which provides a one-time short-term emergency food, telephone, and utilities, is $75,000. This category also includes a state services allocation of $279,052 for the Compassionate Care Program. Priority number 13, housing or temporary assisted living. The proposed allocation for this service is $49,500 from Part A. This service provides short-term housing and support for individuals discharged from a medical facility who are not yet able to return home due to the absence of a caregiver or stable support system. Priority number 14, outreach services, primary care retention and care. The proposed allocation for Part A is $125,000. This is a decrease of $95,000 due to underspending in fiscal year 24. Priority number 15, food bank, home delivered meals. The proposed allocation for this service is $106,120. This includes $100,000 from Part A and $6,120 from state services. Priority number 16, linguistic services. The proposed allocation for state services is $68,000. The fiscal year 2026 service dollar allocations total $30,142,244 under this level funding scenario. Because the exact amount of Ryan White funds we will receive in 2026 is not yet known, we also have a decrease funding scenario and an increase funding scenario. each of which is designed to best meet the needs of the community under different circumstances. These funding scenarios are also included in the information packet on our website. Funding scenarios are as follows. If the Minority AIDS Initiative, or MAI, were to get a decrease in funding, a decrease in funds of any amount will require the Ryan White Planning Council to reconvene and allocate the award after the final notice of grant award is received. If the Minority AIDS Initiative, MAI, were to get an increase in funding, all primary care subcategories would be increased by the same percentage. This applies to the total amount of MAI service dollars available. If Part A were to get a decrease in funding, all service categories except subcategories medical case management for older adults, 50 plus, medical case management for veterans, medical case management for youth, outpatient substance use treatment, service linkage for youth, and service linkage for newly diagnosed and not in care would be decreased by the same percentage. This applies to the total amount of Part A service dollars available. If Part A were to get an increase in funding, the first $300,000 would be allocated to the Health Insurance Assistance Program. Then the next $500,000 would be allocated to ambulatory outpatient primary medical care to be proportionately distributed across subcategories, except for vision care. After that, any remaining increase in funds would be allocated by the Ryan White Planning Council. If Part B and state services were to get a decrease in funding, a decrease in funds of any amount will require the Ryan White Planning Council to reconvene and allocate the award after the final notice of grant award is received. If Part B and state services were to get an increase in funding, the first $200,000 would be allocated to oral health untargeted, divided evenly between general oral health and prosthodontics subcategories. The next $200,000 would be allocated to the Health Insurance Assistance Program. Any remaining increase in funds would then be allocated by the Ryan White Planning Council after the notice of grant award is received. Many volunteer hours were devoted to this challenging work. We sincerely thank all of the community members who work so hard to fine-tune each service category, prioritize the services, and allocate the funds. Public input is strongly encouraged and is an integral part of this process. Depending on the comments made regarding the information presented at this hearing, the Priority and Allocations Committee may meet on Wednesday, July 2nd, to discuss whether the comments provide enough data to justify changing the recommended priorities or allocations. I will now turn the floor back over to Skeet, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing.
Thank you, Jay and Peter, and a very special thanks to the Priorities and Allocations Committee for their hard work this year. After hearing the information presented this evening, you may want to give public comment to the Planning Council. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. There are several options for you to provide public comment to the Planning Council. You are not required to give your name or HIV status to do so. You can email comments to feedback.rwpc@harriscountytexas.gov. You can fax comments to 713-431-4880. You can phone in your comments to 832-927-7926, or you can send your comments through our Facebook page, RWPC Houston. Comments received by our office before 10 a.m. on Tuesday, July 1st, to be forwarded to the Priorities and Allocations Committee for review and consideration. If significant public comment related to the service allocations are received, the Priorities and Allocations Committee will meet via Zoom at noon on Tuesday, July 1st, to review the comments and consider revising their recommendations. On July 3rd and July 10th, the Steering Committee and Planning Council will review and vote on the fiscal year 2026 service funding allocations. You are welcome to attend any of these meetings, either virtually or in person. Please check our website calendar for meeting packets, location, and Zoom information. This concludes the final Ryan White Planning Council public hearing for 2025. I would like to thank everyone who viewed the program for participating in this important process. As stated earlier, the funding recommendations presented tonight will not affect how services are delivered now, but will impact how services are delivered in the year 2026. The Ryan White Planning Council meets on the second Thursday of every month at noon in a hybrid format, which gives you the option of attending in person or virtually. Please check the calendar on our website, wrpchouston.org, for the location of meetings and the Zoom link. Staff may be working remotely, so please call rather than come to the office if you need additional information. Time is running out to apply for Project LEAP 2025, a free training program which looks at the HIV prevention and care system in the greater Houston area. Please visit our website to download an application or submit your applications online. Applications are due by July 19th. This is a wonderful learning experience, and I encourage everyone interested in HIV services to apply. If you would like to send comments to the council, request additional information, or learn about education classes such as Project LEAP, you may do so by calling the Office of Support at 832-927-7926. And you can send an email through our website, rwpchouston.org. On behalf of the Ryan White Planning Council, we thank you again for participating and have a good evening.